There's something nobody tells you about mental disorders. They don't always look dramatic. They don't always look dangerous. Sometimes they look like the quiet friend who zones out mid-conversation, or the straight-A student who can't sleep without the lights on, or the adult who's working, smiling, functioning, yet breaking in ways you'll never see. The truth is simple. You've already met people with these disorders. You just didn't know how to read the signs. So let's change that. Right now. Because once you understand what these disorders actually look like, you'll never unsee it again. Most people think mental disorders are loud, obvious, impossible to miss, but the reality is the opposite. They're subtle, they blend in, they hide behind routines, achievements, even humor. People get really good at functioning while falling apart. This video isn't about labels. It's about understanding the people you care about and maybe finally understanding yourself. So let's break this down psychologically, honestly, and without sugarcoating anything. PTSD. When your body doesn't know you're safe. People think PTSD is all about flashbacks and war stories, but PTSD can grow out of anything your mind wasn't built to handle. A car accident, an abusive parent, a breakup that shattered your sense of safety. Emotional neglect that taught your brain the world isn't predictable. Here's the part most people don't understand. PTSD isn't stored in your memories, it's stored in your nervous system. Your heart races at harmless noises. Your body freezes when someone raises their voice. Your brain relives danger in microseconds and reacts as if the threat is still here. This isn't weakness, it's biology. Trauma-focused therapy helps the brain relearn safety. But it takes time because your mind isn't fighting the past, it's fighting the feeling of the past. Schizophrenia, when reality shows cracks. Schizophrenia isn't split personalities. It's a split between perception and reality. Imagine hearing a voice that sounds exactly like a real person, but no one else hears it. Imagine believing someone's following you even though they're not, but the fear feels real enough to make your stomach drop. And here's a little-known truth. People with schizophrenia often know something is off. They're confused, scared, trying to navigate a world that isn't lining up with what everyone else sees. Antipsychotic medication helps stabilize the senses and therapy helps rebuild structure. It's not about curing it. It's about giving someone back the life their brain keeps stealing. Bipolar disorder, the emotional whiplash. People romanticize mania. They call it productivity, or creativity, or motivation on steroids. But mania is dangerous. It feels like your brain is sprinting faster than your body can follow. Impulsivity skyrockets. Decisions get reckless. Money disappears. Sleep becomes optional. And then the crash hits. Not sadness, but emotional gravity. Depression that feels like your soul can't lift itself off the floor. Bipolar disorder is exhausting because the highs feel invincible and the lows feel unlivable. Mood stabilizers create balance, and psychotherapy helps someone rebuild trust in their own emotions. BPD, the emotional amplifier. Borderline personality disorder is misunderstood more than almost any disorder on Earth. People with BPD feel emotions on maximum volume. A tiny comment feels like rejection. A minor argument feels like abandonment. And once that emotional switch flips, it's like their nervous system goes into survival mode. But here's the truth. People with BPD love deeply. They attach intensely. They feel everything more than the average nervous system can handle. Dialectical behavior therapy teaches emotional regulation, but the journey is long because the emotions are real and often overwhelming. Autism spectrum disorder, a different neurological language. Autism isn't incapability. It's a different communication style. Some individuals avoid eye contact. Some script conversations in their head. Some find comfort in routines because unpredictability feels like chaos to the nervous system. Autism is a spectrum, which means there are infinite variations. Some people speak early. Some don't speak at all. Some excel academically. Some struggle with sensory overload. Autistic people don't need fixing. They need understanding and environments that make sense to their brain. Dissociative identity disorder, a mind built to survive. DID isn't a dramatic plot twist. It's what happens when the mind experiences trauma so severe it fractures to protect itself. Each identity state holds different memories, different emotions, different roles. It's not acting, it's survival. Long-term therapy helps integrate the identities so the person can live as one cohesive self. But healing happens slowly because every identity was created for a reason. Eating disorders. When control becomes a coping mechanism. Eating disorders are never about food, they're about control, fear, and identity. Anorexia is the desperate need to shrink, because the world feels too big. Bulimia is the cycle of losing control, then punishing yourself for it. Binge eating disorder is using food to numb emotions with guilt hitting later like a wave. These disorders destroy the body silently. They're one of the deadliest mental illnesses, which is why early intervention matters. Recovery requires therapy, medical support, and emotional rebuilding. MDD. When emptiness becomes a lifestyle. Depression isn't sadness, it's numbness. It's feeling cut off from the world, as if everything that once mattered now feels muted. People stop eating, or they eat too much. They sleep all day, or they barely sleep at all. Depression hijacks motivation, emotion, desire, and purpose. But it is treatable. Medication helps rebalance the chemicals. Therapy helps rebuild meaning. Depression lies, and recovery teaches you to stop believing the lies. ADHD, the chaos brain. ADHD is not immaturity. It's a neurobiological difference. Tasks feel impossible. Attention drifts constantly. Time feels slippery. Impulse control struggles. People with ADHD aren't lazy. Their brain runs on a different operating system, one built for speed, not structure. Medication, systems, and strategies help ADHD become a strength, not a burden. OCD, the prison of what if. OCD is one of the most mentally exhausting disorders. Unwanted thoughts intrude, anxiety spikes instantly, and compulsions feel like the only way to stop the fear. Checking locks, hand-washing, counting, repeating rituals until they feel right. But the relief never lasts. With CBT and medication, symptoms become manageable and the mind becomes quieter. Substance use disorders. When escape turns to dependence. Addiction isn't a choice. It's a disorder of survival gone wrong. The brain learns to rely on a substance just to feel normal. Withdrawal hurts. Cravings override logic. Life becomes a cycle of chasing relief. Recovery isn't simple, but it is possible with support, structure, and long-term treatment. Anxiety disorders. When fear shapes your world. Generalized anxiety feels like a brain that refuses to calm down. Panic disorder feels like dying for no reason. Social anxiety feels like a spotlight on your every move. People avoid triggers and slowly lose the life they want. Therapy and medication reopen the world. Mental disorders don't make you broken. They make you human in ways people rarely talk about. Understanding them doesn't just make you more informed, it makes you kinder, more self-aware, and harder to manipulate. Because the more you understand the mind, the less the world can confuse you. If this helped you understand your mind even a little, hit subscribe. This channel is your psychological armor. Stay sharp and protect your peace.